All the 15 countries in West Africa, plus Mauritania, are under siege from drugs. It is an old problem with new and increasingly complex dimensions. The drug menace has reached a new high.
We got to the point where the drugs started actually not being transported out of West Africa and started spreading in our different countries.
Donc, elle existe en Guinée, elle se trouve à proximité de tous les ménages et elle est très accessible aux jeunes et à la population. Et nous avons peu de structures de prise en charge et nous avons peu de personnel qui sont spécialisés dans le domaine de prise en charge. Et il se trouve que maintenant, au point de vue ampleur, le pays est envahi de drogue. Et puis, les problèmes sont situés à plusieurs niveaux.
The drugs of choice and substances abused have now gone from marijuana, heroin and cocaine to exotic pills, sundry cheap substances, tramadol and codeine.
Generally, cannabis, cocaine and opioids, which are heroin and tramadol, and amphetamine-type stimulants were the major drugs that were seized in the region.
Since 2012, when the first clandestine methamphetamine lab was discovered in Lagos, we have discovered about 15 of such labs in 4 states in Nigeria. One of such labs was described by UNODC as a mega lab.
There is a new trend of abuse of substance we call Kush. Kush is a combination of marijuana and other local herbs that are put together just to make people feel high.
There's one they call Coca Light. I don't know if you've heard of that now. They mix drugs, you put it in Coke, you understand? And these youths consume these drugs as though they're just taking a soft drink.
The drug problem in West Africa is said to be underreported. The Institute for Security Studies estimates that there are about 10 million drug users in the region, but empirical evidence suggests that there may just be much more.
The recent published survey, National Survey on Drug Use in Nigeria, puts the prevalence of drug use among Nigerians between the ages of 15 to 65 at 14.2%, which is way above the 5.2% prevalence of the global statistics. And the same survey makes us to understand that 1 out of every 4 Nigerians who uses drug is a woman.
The peak levels for drug use, experts say, is among those aged between 18 and 25. About 60% of the population in West Africa are younger than 25.
On réalise que la Côte d'Ivoire est à la fois pays de transit et de consommation de drogue. Et la drogue est même consommée en milieu scolaire. Et les enfants de moins de 10 ans consomment aujourd'hui la drogue et c'est un drame pour notre pays.
Nous avons des jeunes à partir de 10 ans, les enfants sont déjà confrontés à la drogue. Et les femmes aussi. Avant, il y avait peu de femmes qui se droguaient, mais actuellement, nous avons beaucoup de femmes qui se droguent. Et elles sont dans la production, dans la consommation et aussi dans la vente.
Foi uma missão de extrema importância para Cabo Verde, na medida em que puderam ver in loco onde é que nós estamos em Cabo Verde, as respostas existentes e quais são as necessidades.
The direct and collateral cost to the West African community has been huge. The greatest threat to peace and security in West Africa is now trafficking and consumption of illicit drugs and other transnational organized crimes.
Virtually all our countries have experienced directly or indirectly the threat of terrorism, and they are becoming more conscious about what facilitates terrorism and what could be the enablers of terrorist actions.
There has been a cocktail of initiatives in the past to fight this scourge, but the region remains addicted to the malaise.
We decided that it was time to intervene and make sure that there's that the trade is stopped, not only stopped, but that the people who are on drugs are rehabilitated, which is extremely important for the social fabric of West Africa.
ECOWAS responded with a political declaration and a regional action plan on illicit drug trafficking, related organized crime and drug abuse. The Economic Community of West African States, ECOWAS, came up with a project to lead a sustained coordinated response to save the region from the scourge of drugs. A 4-year project between 2015 and 2019 was initiated to support this action plan with support from the European Union. Specific objectives of the project were to establish sustained capacity for coordination and monitoring of regional initiatives in line with the regional operational plan at the level of the ECOWAS Commission, and empower ECOWAS member states to implement selected national components of the regional action plan for effective coordinated regional response. Targets were outlined: improved advocacy, monitoring and coordination capacity on the part of ECOWAS, harmonized information on drug abuse epidemiology and data collection are available. Good practices on drug prevention and treatment are identified and disseminated. Improved law enforcement for an effective combat against transnational organized crime related to drugs, and improved sub-regional, regional and international cooperation.
Previous interventions were bogged down by mainly capacity in terms of human capacity and financial capacity. The political commitment was high by our heads of state, by the management of the Commission, but then these two critical factors were hindering the implementation of the program. Through the EU support, it has helped us to bridge these two important gaps. If you consider that we had only one staff, and through the project, we were able to get 5 additional staff in various areas of competencies to enhance the capacity of the unit and invariably of the Commission to drive this agenda of ensuring the implementation of the Drug Action Plan.
The ECOWAS Drug Unit, strengthened with professional staff, along with the United Nations Office on Drugs and Crimes, UNODC, worked with ECOWAS member states in Mauritania. They inspired policies, reformed structures, and installed systems to drive effective drug control measures. Monitoring teams visited each country.
The monitoring missions had 2 major objectives. The first one is to look at the level of implementation of the ECOWAS Action Plan, and then to identify the areas of challenges in each member state, the specific area of challenges that needed to be supported immediately under the project. Based on the need assessed in the areas, we were able to immediately come with some kind of support to some of the member states. In fact, there were almost all the member states that were supported based on the monitoring missions and the revelations that came out.
The West African Drug Epidemiology Network window was introduced in all the countries. It will play a critical role in shaping the response to emerging trends in illicit drug trafficking and consumption.
Window collects data on treatment demand indicators as well as aggregated data on drug supply, which means it will give us a picture of who is getting involved with drug, who they are, their biodata, like the distribution of these people, the age distribution, educational qualification, sex, and all that. And then the aggregated data will give us information on the availability of these drugs in the society, like what drug is there, in which location, who is involved, who are the traffickers and all that. So with this information, we'll be able to, fashion out evidence-based policies.
As part of the advocacy initiatives, the campaign was taken to member states to directly engage the most threatened segment of the society, young people, as well as those who hold the fabric of society together. These included sensitization and training programs.
We had advocacy at the highest level of government, and then sensitization at the level of the ordinary citizens. We had sensitization and capacity building training, for example, in Monrovia for religious institutions. We also had sensitization, for example, in Nigeria, Abeokuta precisely, where we had to meet various levels of leadership. In Benin Republic, for example, there was sensitization at schools. We were able to visit 10 schools, secondary schools, and at least we reached more than 1,500 students directly with the message of drug prevention, drug management, and how at their age they could even play a critical role in preventing drugs amongst their peers and even amongst the adults.
If you go to a place like Gambia, you go to a place like Sierra Leone, you go to a place like Liberia, you go to Cape Verde, these are where we have trained people we can call core drug education, about 30 each in these countries. These are the people who will now take drug education in their respective countries.
Civil society at each stage were also involved during the step-down training. We invite civil society organizations. We also ensure that we have representatives from our civil society network, the West African Civil Society Network, which is WANSA.
And for 4 years, the focus was on advocacy, monitoring, and coordination. In April 2019, experts and ministers from member states under the aegis of the Interministerial Drug Coordinating Committee at the ECOWAS Commission headquarters in Abuja assessed the impact made by the project.
It provides an opportunity for us all to take stock of the achievements made, challenges being faced, and the additional efforts required in our collective efforts to address drug abuse, illicit drug trafficking, and related organized crime in the region.
One of the major accomplishments of the project was the production of detailed reports by the monitoring missions deployed to all the ECOWAS member states and Mauritania. The monitoring reports, which the meeting validated, are status reports on the drug control mechanisms in each of the countries in West Africa and Mauritania. This provided a clear insight into how each of the countries has been fighting the drug menace.
We had a regional report. We have what we call synthesized report that talks about, when you take the region as a whole, what is the status of the implementation of drug activities, and then at the individual member state level. So 2 issues: the regional level, we have the synthesized report, and then the member states too, we have the individual country reports as guides for future drug prevention and control activities.
Et j'ai participé personnellement à 2 évaluations, à celle du Togo et à celle du Burkina Faso. Et nous voyons que ce projet a quand même permis à nos pays d'avoir des résultats vraiment probants, que ce soit en matière de renforcement des capacités et sur l'engagement politique, sur les systèmes de coordination. Nous avons vu que ça a évolué dans beaucoup de pays. En ce qui concerne aussi la réduction de la demande, il y a eu beaucoup de formations, il y a eu beaucoup d'activités, et on voit que cet aspect qui était négligé dans nos pays.
This monitoring team is kind of an, will I call it an eye-opener? What it has done is to draw our attention. Okay, it gave us the opportunity to even take stock, assess ourselves, and then our attentions are drawn to those areas that we are not actually measuring up.
After their visit, a lot of things have happened, and there is a change now, meaning that there is collaborative effort among all of us to see how best we can fight this menace of drug abuse.
The The project also helped West Africa in crossing another major bridge: the dearth of reliable statistics relating to all facets of the illicit drug problem in the region. The first drug situation report of the West African Epidemiology Network on Drugs, WENDO, was presented.
This WENDO report serves as a baseline data. It captures and presents to us the drug use pattern and emerging trends as relates to illicit drug trafficking and drug supply and drug abuse, and also will be able to guide policy effectively.
Ce programme a un impact très important dans la mesure où déjà ça permet, avec l'utilisation de l'outil WENDO, d'avoir une visibilité sur les statistiques en matière de consommation de drogue au Bénin. Parce qu'il y a des agents qui ont été formés, qui sont un peu répartis sur toute l'étendue du territoire national, qui collectent un peu les données et qui les envoient au SIRAS, qui les compilent et les analysent.
This addresses the lack of data, which has hampered the fight against the scourge and creates a critical baseline for future monitoring.
Overall, more than 700 individuals have been trained. Their capacity has been built in size estimation and also data collection, and how to analyze this data and to ensure that the data representation and completion is high in this report. This will help us reduce missing data.
Flowing from these reports, ECOWAS made two critical discoveries that could be deterring those seeking to turn away from illicit drugs. First was the fact that drug rehabilitation facilities were virtually non-existent in most member states. And secondly, local experts to provide specialized care were quite few.
We saw that in our member states, there was a gap.
Au point de vue ampleur, le pays est envahi de drogue et puis les problèmes sont situés à plusieurs niveaux, c'est-à-dire les 4 axes d'intervention. Nous avons les problèmes au niveau de la prévention, au niveau du traitement, au niveau de la répression et au niveau de la réhabilitation. Parce que là, on n'a pas de structure de réhabilitation.
In some countries, there were buildings which were available. And what ECOWAS is doing is to support these countries to now develop these buildings into a rehabilitation center. We have one in Sierra Leone, and we have one in Gambia. We have one in, there are 3 countries, Gambia, Sierra Leone for now, and then Togo.
To grow local capacity in drug demand reduction, ECOWAS employed the Colombo Plan.
Et la CEDEAO, à travers son plan régional, soutiennent le Burkina Faso afin que ce programme soit installé dans ce pays. Colombo Plan permet de lutter efficacement contre la drogue parce qu'il permet la prise en charge efficace, efficiente des usagers de drogue. Il est bien bon de prévenir l'usage de drogue, mais il est aussi assez important de faire en sorte que les personnes qui sont sous l'emprise de la drogue, qui sont dépendants de la drogue, puissent bénéficier des traitements.
5 countries have benefited under this program: Togo, Mali, Niger, Burkina Faso, Gambia. And within the scope of this intervention, we've been able to train 80 professionals that have become certified addiction professionals within our region. And they will be able to provide improved services for treatment of substance use disorders within their countries.
As part of the project, a draft mapping matrix for legal texts on drug control and related crimes was developed.
We feel that in the context of a functional criminal justice system, forensics needs to find its rightful place, and we felt that we needed to focus that assistance at the level of both the laboratories but also the law enforcement agencies and the way they would deal and handle physical evidence. Another area of support has also been legislative reform.
Nous avons une législation commune avec un certain nombre d'États. Sur la question essentielle de la répression, nous avons mis en œuvre une nouvelle juridiction qui est la Cour de répression des infractions économiques et du terrorisme, qui est compétente en matière de drogue. Et nous sommes également en phase avec ce que souhaitent les experts de la CEDEAO, sauf qu'ils sont un peu pressés, le rythme auquel ils veulent voir avancer nos États pour ce qui concerne la pénalité des consommateurs semble ne pas vraiment nous convenir. Nous devons y aller pas à pas pour permettre une bonne appréhension, pour une bonne maîtrise du phénomène depuis la chaîne de distribution jusqu'à celle des consommateurs.
Overall, the ECOWAS drug unit in the member states are now better positioned to intensify the fight against illicit drug trafficking, organized crime and drug abuse with the programs actualized under this EU-supported project.
Now we are monitoring the level of implementation of the drug action plan. So nobody wants to sit down and then has a report that says that you have done nothing. So every member state is now doing something to show that yes, we are implementing this drug action plan.
La CEDEAO nous assiste, ECOWAS nous assiste dans la lutte contre la drogue. D'ailleurs, la CEDEAO a financé récemment un plan mauritanien pour la lutte contre la drogue.
Il y a eu renforcement des capacités des acteurs, il y a eu dotation en matériel, il y a eu amélioration de la collecte des données. Et il y a eu...
This will help us, all of us, to coordinate our efforts and strategies, and each one of us can try his best to fight against this malady.
We're comfortable knowing that the countries are in a position where they do have the capacity to run their own programs. Now, and the team at ECOWAS is also an excellent team, and they work directly with the countries. The investment has been huge in terms of right now helping them rehabilitate infrastructure or helping train doctors and nurses to work with drug addicts. That's quite a bit of money, and it's all coming from ECOWAS and the EU partnership.
The road ahead may still be rough, especially as the Institute for Security Studies projects that the number of drug users in sub-Saharan Africa is expected to increase by nearly 150% by 2050. However, West Africa is fighting back to confront the scourge and save the future of the community. The EU-funded project has helped this cause. From trafficking to consumption, West Africa has a better appreciation of its drug situation and what needs to be done to confront it.